Welcome to this month's Well Aware presentation. In order to hear the narration, please be sure to turn on your speakers. The presentation will start momentarily and will automatically play. You can pause the presentation at any time by clicking on the lower left of your screen. Hello everybody, my name is Beth Grigg and I'm the Director of Residential Health Services at Windermere. I'm presenting this to you on behalf of the LCS Residential Health Resource Team and in collaboration with the LCS Lifestyle and Health Services Program. If you have any questions or comments about this presentation, I welcome you to reach out to me. My contact information will be provided at the end of this presentation. I'm always happy to help you learn more about our well-aware topics and to help you connect to your own community resources. This month's presentation is going to be about memory and your brain, a how-to guide for maximum strength. We like to look at wellness from a full body point of view, so we're looking at all dimensions of wellness: emotional, environmental, spiritual, social, vocational, intellectual, health services, and physical. This presentation taps into quite a few of those dimensions of wellness, but in particular, we'll be focusing on intellectual wellness and physical wellness. Who is this presentation for? It's really for everybody. For residents, in independent living, assisted living, and in the health center. For employees, for your own benefit, as well as learning about how you can support our residents, and for any family members that might be interested in getting this information as well. Before we get started with this presentation, I'm going to teach you a little warm-up exercise. This is a great thing to do before you're getting ready to do an activity where you're going to have to really think. For example, if you're going to be paying your bills, why don't you go ahead and try to do this exercise before that? It's also a great exercise to do before you get out of bed in the morning. It's wonderful to wake up your brain, get you started, and get you ready for the day. This is what the exercise is. It's very simple. All you need to do is wiggle your toes. You can start doing it now if you like. Slowly begin to move your toes any way that feels good. Wiggle, scrunch, stretch. Move all of your toes up and down several times, or just work your big toes. Why this works is the act of wiggling your toes activates nerves that stimulate your brain and other internal organs as well. So it basically, in essence, is telling your brain, wake up. It's time to do something important. I want you to get up and get ready to go. It helps you become alert more quickly and get you ready to be focused. The main part of this presentation is going to focus on how to make your brain as strong as it can possibly be, and in turn, reducing potential problems with memory. But I think it's important that we talk a little bit first about some background relating to brain disorders. A lot of folks are concerned about what dementia is, what it looks like, what might happen if dementia becomes part of their life, and then we'll talk about prevention. So we'll start first by talking about what is dementia. In a nutshell, dementia is the disease process in a brain where memories are not retained and prior activities, abilities, function, and cognition slowly decline. So one thing I hear from folks is, I'm 80, I'm 90. What do you expect? I'm prone to losing my memory. One thing that's important to know is dementia is not a normal part of the aging process. Yes, some loss of memory, unfortunately, is part of what happens when you get a little older, but dementia itself is not. And that's where I want to help guide you, to help you understand what is a normal symptom and what is something that you might want to get looked at. So when we talk about dementia, most people assume that dementia is Alzheimer's disease. That's a very familiar term for all of us. But just so you're aware, dementia can actually take the form of other types of processes, including Lewy body dementia, vascular dementia, and then there are actually some reversible type of dementias that we'll talk about. One of the most important things that I think I can pass on to you about dementia is to consider getting an evaluation sooner rather than later. It's very easy to become afraid of having this as a diagnosis, but the sooner you can start working with your physician and your medical team about a dementia, the more likely that there's going to be benefits from some of the therapies and treatments that are out there. So what is it that you want to be watching for? What are particular symptoms of dementia that your doctor would want to be aware of? So, of course, one of the symptoms that would be a potential for being indicative for dementia would be memory loss. People with dementia have memory loss that significantly interferes with daily life. And that's the part that I want you to remember, that when it says significantly interferes with daily life, I'm not talking about memory problems like, oh, I forgot where I put my keys, or I can't remember that person's name. I'm talking about things like forgetting how to get home, forgetting important family members' names. That sort of thing is more likely that a dementia is starting to take effect, and that would be very important for the physician to know about. For some people, when they're progressing with their dementia, you might notice some repetition going on. People with dementia may repeat stories, sometimes word for word. They may keep asking the same questions, no matter how many times they're answered. Now, this isn't somebody who loves to talk about their grandkids and just really enjoys saying the same stories over and over and over again. This might be somebody who will ask you, what's for dinner tonight? And 2 minutes later asks you, what's for dinner tonight? And again and again, and truly does not have any recollection that they've already asked you that. Language problems and changes can also be a symptom of progressing dementia. People with dementia can have profound problems remembering even basic words. Their way of speaking may become contorted and hard to follow. Sometimes you'll find that they just don't have the ability to state even just the most basic needs or wants. One thing that you might see is using other words to try to describe a particular word because they can't find that word any longer. So, for example, if somebody was asking you for a pencil, instead of saying, could you please pass me the pencil, they might say, I need that yellow writing tool. They have forgotten the word pencil, and they're doing their best to make accommodations for what their memory loss is having them experience. Personality changes can also occur. People with dementia may have sudden mood swings. They might become emotional, being upset or angry for no particular reason. They might become withdrawn or stop doing things they usually enjoy. If all of a sudden somebody who their whole life has enjoyed playing bridge suddenly stops wanting to go play, that could be a sign that they might have a progressing dementia. Interestingly enough, you might see some conflicting personality changes. Some folks might become uncharacteristically suspicious of family members, people that they've loved their whole life. Suddenly, they're not trusting of. And on the flip side, they might suddenly start becoming trusting of people that maybe they shouldn't, like telemarketers and other people that might open them up to problems relating to scams and safety issues. Sometimes when somebody has dementia, you might notice a little bit of what we would call odd behavior. People with dementia can be prone to placing objects in odd and wholly inappropriate places. For example, they might put a toothbrush in the refrigerator. They might put milk in the cabinet under the sink. Sometimes unsafe situations can happen. People might store their paperwork in their oven or keep their medication bottles on top of their range and not realize when they turn on the stove that, of course, that's a huge fire risk. Another thing that we see quite often is that disorientation and confusion. People with dementia may get lost in places they know very well, like their own neighborhoods. They may have trouble completing basic and familiar tasks like cooking dinner or shaving. Sometimes it's easy for family members to get frustrated. Say, for example, they notice that their loved one is getting thinner and thinner and not eating like they used to. It might not be that they're intentionally doing this. They might have forgotten how to prepare a basic breakfast. They might have forgotten how to go to the store, what they need to get. And they might have just lost the ability to understand that they have to eat and should eat. So that is a very important symptom that you definitely would want to report to the physician. Lack of hygiene. Sometimes this can be the most obvious or first sign of dementia. People who have dressed smartly every day of their lives might start wearing stained clothing or stop bathing, stop shaving. Sometimes losing the ability to take care of themselves is one of the more obvious things that you might notice with the progressing dementia. So dementia can be very scary, and hearing all of those symptoms, might make you a little fearful. But just rest assured that there are things that can be done. One of the first things that I would recommend to you is to go to your physician for an evaluation. We talked earlier that there are some kinds of dementias that are reversible. For example, one thing that we see very often in our senior population is confusion related to a urinary tract infection. If all of a sudden one of our residents becomes suddenly confused, a little disoriented, one of the first things that we'll do here is to ask the physician for an order for a urine culture to see if there is a urinary tract infection going on. And if there is, you go on a round of antibiotics, and oftentimes that temporary dementia or confusion will go away. Other medical conditions that could mimic dementia symptoms or could actually give dementia to a resident, medication side effects, that's a common one as well. Everybody responds differently to medications, and certain medications can make a person prone to some confusion and disorientation. Thyroid problems can give symptoms of depression as well, and that's an easy test for your doctor to order to see what your thyroid levels are and to see if that's causing your body some issues. Neurologic problems, for example, a stroke or a TIA, which is what I call a mini stroke, those treatments would be completely different than the treatments that you would do for dementia, and would be very important for your physician to work with you on those treatment plans. If there's any question at all at any time, if your loved one might be having a stroke, if it's sudden onset of symptoms, sudden confusion, sudden difficulty talking, sudden difficulty communicating, paralysis on one side of the body, inability to talk, please don't hesitate. Call 911 and get your family member or yourself or your friend into the emergency room. Other types of conditions that could contribute to dementia symptoms, vitamin deficiencies, insomnia. Insomnia can be a big problem. And you know yourself, if you miss a night of sleep, how kind of fuzzy you feel the next day. Imagine that night after night after night it can accumulate and start mimicking a dementia. So you would want to have your sleep evaluated. Stress can very much impact the brain, and we'll talk about that later on. And depression is something that is really important to have addressed. Oftentimes, the symptoms of depression almost exactly mimic the symptoms of dementia. And what's important is to figure out if the symptoms are related to dementia or to depression or both, because every avenue will have completely different treatment plans. And you want to make sure that you and your physician are treating the appropriate underlying condition. So we've spent some time now talking about dementia, about symptoms, about what you can do if you are having those symptoms. Now we're going to switch our focus, and we're going to talk about how you can strengthen your brain, hopefully to prevent any kinds of memory problems or stall the memory problems from happening, and how to really maximize your personal strength in relation to building up your brain muscle. So we're going to be talking about some different brain health theories. There are many, many theories out there right now, and sometimes it can be hard to know which ones you can trust, which ones are valid. You know, from my point of view, it's hard to know really which ones are going to be effective, which ones aren't. My point of view is take a look at all of them, maybe do a little bit of each one. Don't put 100% stock in any one particular one of these brain theories coming up, but consider all of them. Take notes as we go through this. If there's any ideas that strike your fancy, go ahead and jot it down and give it a try. None of these are going to hurt you. They can only benefit you. So I hope that you enjoy some of these games and activities and different theories that we'll be talking about coming up. As we dive in, I think it's important that I give you just a very basic anatomy lesson on the brain. It used to be thought that once a brain cell was dead, that was all there was to it. It couldn't grow back. Nothing could be improved on. And it was thought for a while that once you kind of got to a certain age, your brain stopped developing. It wouldn't grow anymore. And they found now that's not the case. They have found with many studies that the more that you exercise your brain, the more neural pathways that you develop, the more memory retention you have, and they've actually found that your brain actually gets heavier. You are building more brain as you work it out. So that's very important to know and to be encouraged about. The other thing that's changing with memory theories and studies and science, they used to think that there was only one part of the brain really responsible for memory retention and filtering, and that's a little area kind of right near the middle of the brain that's called the hippocampus. And the hippocampus is responsible for determining where memories go when they come into the brain. So the memory comes in, the hippocampus takes a look at it, and it says, I'm going to put that in my long-term memory bank. That's something that's really important to me. I want to make sure I remember it forever. Then the next memory comes through, and the hippocampus looks at it and says, it's okay. I want to keep it for a little bit. I'll put it in my short-term memory bank. And other memories that come floating through gets evaluated by the hippocampus, and the hippocampus might say, that's not important to me at all, and it's going to go right out of my mind. So when somebody starts having problems with their memory, oftentimes it's thought that the hippocampus, just isn't working as effectively as it used to, and that could very well be the case. But what they're also finding is now that there are several areas of the brain that do have a component to that memory retention. And the slide that is up right now is showing you some of those areas. So what's important to keep in mind, say, for example, the frontal lobe does have areas that are responsible for memory retention. It's part of what that part of the brain's responsibility is. So if you exercise your brain in other areas like judgment, critical thinking. Those are other responsibilities for the frontal lobe section of the brain. If you exercise using some of those types of exercises, you are increasing blood flow, you're increasing neural pathways to that part of the brain, and that in turn should, according to science, also help to improve your brain function. So what you want to do with these exercises is to try a whole bunch of different ones out, because what you're doing in effect is exercising all areas of your brain, even those parts of your brain that you really don't use on a regular basis. You want to get them active. You want to get the blood flowing, so that in turn can help benefit you with a stronger memory. So we'll start talking about theories. One theory is the idea of how music can impact your memory and your cognition. There have been many studies done about this topic, and they have found that scientifically, music has been shown to improve learning time, calm, soothe, and act as a stress reliever, reduce errors, improve creativity and clarity, heal the body faster, and integrate both sides of the brain for more efficient learning. And this is something that's very interesting. A McGill University study showed that you can activate different areas of the brain depending on what kind of music you listen to. So, for example, they found that in listening to classical music of the Baroque era, people with dementia actually improved their memory tests. So that's something that's very interesting to consider, and that's something that's very easy to do in your home. What I would recommend is to listen to a wide range of musical types: classical music, jazz, rock, pop, hip hop, new age. All those different types of music stimulate different areas of the brain. In listening to music also, you'll find that your long-term memory bank is engaged. You probably have had an experience at one point where you hear a song and immediately your mind is brought back to a time in the past that's related to that song. That is a very powerful exercise for you to work out those long-term areas of your brain as well. A lot of people have a favorite kind of music that they like to listen to all the time, and that's good. That's important for your brain for a lot of reasons. I'm going to also encourage you to listen to other kinds of music. Get out of your comfort zone, stretch your brain, listen to different types of music, even those kinds that you think you might not like. You might be surprised, and it might be effective in working out those areas of the brain that don't get as much use as you might like. So how do you use music therapy in your life? This is what I recommend. Turn on some music, sit down in a comfortable chair, close your eyes, and just simply listen to the music. How does it make you feel? Does it bring back any memories? If you want a very strong exercise that you can do while you're listening to music, write down what you feel when you're listening to it. Just the act of putting your thoughts down on pen and paper is a very powerful brain exercise. And when you're incorporating it with music, it's even more powerful. The other thing that you can consider with music therapy is just having music on as that background noise throughout your regular day. If you're getting ready to do some hard work that's going to require a lot of thinking, you might want to consider putting on some light classical music in the background to help stimulate all those areas of the brain that Baroque music helps with. We're going to talk now about another kind of memory theory, and that's called neurobics. And this idea was brought about by the book that's shown here, Keep Your Brain Alive, by Lawrence Katz and Manning Rubin. And what they talk about in this book is the idea of engaging your brain in unexpected new ways. A neurobic exercise involves one or more of your senses it engages your attention in a new way, and it breaks a routine activity in an unexpected way. So what kinds of activities are considered neurobic? An interesting example of a neurobic activity can be brushing your teeth with your non-dominant hand. So if you're a righty and you always brush your teeth with your right hand, switch to your left. If you always answer the phone and hold the phone on your left ear, switch it to your right. If you want to do something that's even more challenging but very good for your brain, try doing some writing using your non-dominant hand. Get out a book of mazes and try doing the mazes with your non-dominant hand. Other neurobic exercises can be learning something new, start a new hobby, learn a new language. That's one of the most effective brain exercises you can do, is learning a new language. Other things that you can do: engage your senses, use aromatherapy in your home, take a different route home. If you're always used to going in a certain pattern, go a different way. We've all gone into autopilot before, or all of a sudden, you're home and you don't remember driving home because you just did it, by pure memory, and you didn't have to think about it at all. Take a different route. You'll see new things. You'll experience new things. You actually will have to be engaging your brain in the process of getting home. A very simple neurobic activity that you can try is when you're shopping, try to find correct change without looking. So if you're going to be paying with quarters, nickels, dimes, just reach into your pocket or reach into your purse and try to pick out the coins that you need based solely on touch. So it's interesting to me that the neurobics theory encourages you to use your brain in ways that are unexpected and unusual for you and get you out of your usual, what I call a rut. This next theory that we're going to be talking about goes completely in the other direction and wants you to use your past experiences and common practices in order to build up your brain power. So this theory is called brain age. You can see on the screen one of the advertisements for it. It is a program that's on Nintendo DS, and there are similar programs on the computer that you can find pretty easily. What the brain age theory suggests is that better brain power can be achieved by rapid, quick thinking exercises. These exercises promote blood flow and increase neurotransmission of all areas of the brain, even those parts that are typically infrequently used. So I'm going to be showing you a few slides that Brain Age has put together that demonstrates the power of what they're trying to encourage people to do. So as we look at the following slides, you're going to see that the areas of the brain that are depicted in red are the parts that are activated during the activities listed. So here's a picture of the brain in what we would call idle thought. So, you're not really doing anything. You're kind of staring at the wall. You're kind of hanging out. Not much of anything. You might be waiting, to go in to see your doctor, or, just kind of trying to calm down at the end of the day. Those little areas of the brain are the parts that are activated just while you're chilling. This part of the brain you can see is much more engaged. There's a lot more red area of the brain that is activated. This is what happens to your brain if you solve simple math problems quickly. Quickly is the key word. One of the exercises that they have you do is to do multiplication and simple addition and simple subtraction, but to do it as quickly as possible. And this is what they say happens to your brain when you do those kinds of exercises. Look at this one. This one has even more red parts of the brain, so that shows more brain activated. And this is what they say happens when you read something out loud quickly. Now, I'm not saying that when you're reading this out loud, the intention is not for comprehension. You are just simply doing what you can to read out loud as quickly as you possibly can. And this is how it impacts your brain. And a lot of people are surprised when they see this. And it's good to be surprised because it's a pleasant thing to know that there's something that you can do very easily in your own home that will activate the blood flow as much in your brain as the simple activity. So what are some things you can do that would help maximize your brain from a brain age theory perspective? Well, here's some things. Doing multiplication tables or addition problems. When's the last time you sat down and actually wrote down or said out loud all your multiplication tables? That's something that you can easily do if you're waiting for something. You can do them in your head. You can do them on paper. Another thing that's very simple to do has to do with that reading out loud that we talked about before. When you get your newspaper in the morning, before you get in there and read it to understand the articles, just spend some time reading the articles out loud as quickly as you can. When you're shopping, try adding up groceries in your head instead of using a calculator or your phone. You want to start doing that basic those math exercises in your head, and that's an easy way to do it. And instead of reading to yourself, if you have a good book and you're interested in reading it, find a friend and you can read it out loud to that friend, and it'll benefit both of you in several different ways, not just in the brain age theory, but also with connecting with a friend, with spending time together. That's a very powerful brain exercise as well. We're going to look at another brain theory now, and this one's based more on a clinical point of view, and that's how stress can impact your memory and what you can do to reduce stress in your life. So the question is, how does stress affect memory? If you look at this picture, remember this picture is the one that shows the hippocampus. And if you remember, the hippocampus is one of the primary areas of the brain responsible for memory retention and filtering. This is something that I want you to know about. When the brain is stressed, it releases a hormone that's called cortisol. Cortisol is otherwise known as the stress hormone. It's your body's way of getting ready to protect itself because it sees some kind of a threat. Unfortunately, cortisol is toxic to the hippocampus section of your brain. So if the hippocampus is damaged over a long period of time because of chronic cortisol circulating in your body, memory retention can be affected because of it. So that's an important thing to realize, that there actually is a physiological reason why stress can directly impact your memory. So taking a look at that, realizing that it's not as easy as we think to just say, just to remove stress from your life. But if you find that you are very stressed for most of the time, if you have a lot of worries, if you have a lot of anxiety, it's definitely worth having a conversation with your physician about. You can start thinking about ways to reduce that stress. Maybe that might be through counseling or through psychological support. Maybe it might be through exercise or through exercising like yoga or Tai Chi. Maybe it means spending a little bit more time for yourself, doing things that you enjoy, spending time with family or friends. Whatever you find helps you reduce your stress, that might be a very important thing to start incorporating more of in your everyday life. So we've only tapped onto a few memory theories so far. There are so many more out there. If you've spent any time at the bookstore or online or on TV, you'll see that books and websites and articles and information is out there, by the hundreds. I've put here just a few of the brain books that are out there. Some might look familiar to you, some might not. And the question comes is, how do you know what you can trust with all of these different types of products and media out in the world right now. What can you rely on? So here are some tips that I just want you to keep in mind. Remember that there is no magic cure. If there is an irreversible dementia going on, like an Alzheimer's, like a Lewy body or vascular dementia, there is not a cure at this point. So if there's a website or a bit of information that's saying, oh, we can cure your dementia, we can cure your Alzheimer's, that to me would be a red flag going up. Because unfortunately right now, that isn't something that's able to have happen. You would also want to make sure that you review anything that you're going to be trying out with your physician, especially if it has to do with over-the-counter supplements, because sometimes a supplement, even if they're saying it's all natural, can actually impact you in a negative way. It could impact medications that you're on. It could have side effects. They're not regulated like prescription medications are. So it's very important to make sure you talk over with your physician anything that you're going to be doing before you start a brain health regimen. And the other thing that I want to suggest that you do, and we talked about this a little bit at the beginning, do a little bit of everything. Everyone has a different theory. Everybody has, have different scientific studies that, show exactly what they think is going to be the best to help your brain. Take a little bit of information from every theory that you're here and try a little bit of everything. And that's my best direction for you to help make sure that you approach this whole project of brain fitness, with an open mind, but also with some realism about what potential benefits that you might get from any of these theories. So in doing a lot of research over time about different brain theories, one thing that I've found are the commonalities between some of these different theories. And those are the ones that I want to bring to you, to give you information about, because it seems like the ones that we're going to be talking about now do have more validity to them, more scientific assessment related to them, and you might have pretty good luck in doing some of these tips. The first thing that we're going to talk about that's a commonality between different theories about memory is the concept of nutrition, what you can eat that will help strengthen your mind. So there are a lot of wonderful foods that have been shown to promote brain health. Foods like blueberries, coffee, they have shown to reduce your risk of Alzheimer's. Unfortunately, the study that was done shows that you need to drink at least 4 cups of caffeinated coffee a day. So that caffeine might be a little too much for some folks, but they have shown significant benefits with coffee drinking related to Alzheimer's. And as a side note, decaf coffee also is beneficial because coffee is rich in antioxidants, and antioxidants help to protect the brain. Red wine is beneficial for brain health. There's a component of it called resveratrol that is good for maximizing your brain strength. What the recommendation is currently is 1 glass for women, 2 glasses for men per day. If you get into more than that, then you start having other problems. Salmon, walnuts, green leafy vegetables, green tea, those are all foods that are high in omega-3 fatty acids or antioxidants, and have shown to have a direct impact on your brain health. Apple juice, olive oil, chocolate, dark chocolate can be wonderful for your brain. Oatmeal, they found that the insoluble fiber and the soluble fiber, both of oatmeal, is very helpful for your whole body, including your brain. It actually gets into the vessels in your brain and kind of scrubs them out a little bit, makes sure that the blood flow is good. Cinnamon is helpful because it helps to regulate your blood sugars and prevents problems from happening with your thinking related to blood sugar fluctuations. Turmeric is one of those mighty spices right now. There's a lot of research showing that eating turmeric is very beneficial to your brain. And broccoli is, of course, a power food that you can consider eating. We mentioned earlier in the presentation that different vitamin deficiencies can be responsible for some dementia. Sometimes it can be a reversible type of an issue. They're finding more and more information these days about vitamin D and vitamin B and the impact of your full body, including your cognition and your risk for progressive dementias. So an easy thing to do is to talk this over with your doctor, find out when you last had your vitamin D and vitamin B levels checked, and get a simple blood test to see. We talked before about the impact of stress on your body and on your mind, and how if you have chronic stress, that cortisol is released in your body, and the cortisol is toxic to the hippocampus, which is the memory retention part of your brain. So one thing that you can consider doing to reduce some of that stress are trying activities like yoga, tai chi, meditation. If you live in a place where you have access to some of these exercises in a group activity format, then that's terrific. That's a very easy way to do everything you can to maximize your brain function. If you don't live in an area where those services are available and you do have access to the computer, go ahead and pull up YouTube. There are a lot of classes online that you can take for yoga, tai chi, and meditation that's directly related to stress relief. So you can try those out. Taking a class, learning something new. We talked before with some of our theories, including the neurobics theories, about engaging your brain in new and innovative ways, increasing the neurotransmission that goes on in your brain, increasing blood flow. So when you're taking a class, when you're learning something new, you actually are building more brain in the process. So that's something that's a very easy thing to do, whether it's a class in person, a class online. There are a lot of classes you can take now through universities for free online. Or there are a lot of classes that might happen through your park district and your community. Something that you can do that's interesting to you, but maybe is something that's different than anything you've done before. Live a life of gratitude. There are more and more studies that show the health benefits of gratitude, and that includes the brain health. The more gratitude that you experience in your everyday life, the stronger your brain is. And a component to that can be the fact that the more gratitude that you feel, the lower depression that you have, or the lower cortisol levels that you have in your body. And as we know, both of those things can contribute to memory loss and problems with your brain power. So concentrating on gratitude, thinking about a few things every day that makes you thankful can be a very powerful activity for you to do. Getting out in nature, getting outside in the fresh air, in the sunshine. We talked about vitamin deficiencies. A lot of people these days are deficient in vitamin D because they try to avoid the sun, which of course, we know is important from a skin point of view, but we're lacking in the vitamin D that we used to get. Also, just the natural depression relief that you get from being outside is a very powerful thing. So that's an easy thing to do. Exercise in itself is very important. It promotes blood flow. It gets that blood going to the brain. So going for a walk outside is one of the best things you can do to maximize your brain health and to prevent an Alzheimer's or another dementia from happening. We talked about this earlier, but I'm going to say it again because it's very important. Talk to your doctor. When you have your regular checkup, talk about your physician, about any memory or brain problems that you're concerned about. Be open and honest with them. Have a checkup for depression, diabetes, heart disease, thyroid issues. All of those things can have an impact of your brain and how you think. you might want to consider playing some what I call brain games. So things like Scrabble, crossword puzzles, Sudoku, concentration, trivia, word searches, mazes, brain teasers, logic puzzles, Pictionary, checkers, chess, board games. Those are all fantastic ways to engage your brain. A lot of them you play with a friend or with a family member, and the socialization part of it is very important. The combination with the brain game and the socialization is a wonderful way to engage a lot of areas of your brain and to promote brain strength. The one thing that I do want to encourage you to do is to do a wide range of these kinds of brain games. I have a lot of folks that say to me, "Oh, I'm doing everything I can because I'm doing a crossword puzzle every single day and I have for years." Well, that's great. Crossword puzzles in itself are a very good brain tool. It's when you do them every day and that's the only kind of brain game that you do, that's when maybe you're not getting as much of an impact as you might think that you are. So I would encourage you to go ahead and keep doing those crossword puzzles, but try to do other kinds of brain games also, so you can really get a full experience and maximize these exercises that can help strengthen your brain. So that's a lot of information. We've talked about a lot of different kinds of brain theories, a lot of different activities that you can do to strengthen your brain. And what I want to leave you with is the idea that there really are three main ways that you can maximize your brain health and strengthen your memory. And these are the three ways. Number one, physical activity. Physical activity includes exercise, yoga, meditation, tai chi. It includes the concept of good nutrition. It includes good sleep hygiene. Those are all under the umbrella of physical activity. The second best thing that you can do is cognitive exercise. That includes those brain games we talked about, crossword puzzles, board games, trivia. But it also includes learning, going to classes, having discussions and debates with people, trying to stretch your brain and grow new brain pathways by learning and using your mind to engage. The third best way that you can exercise your brain and to keep it strong is through socialization. And it's very important that you do spend time around other people, because that's one of the most important ways that you can keep your brain as strong as possible. So having meals with people, calling people on the phone, even writing letters can be a good thing. Emailing back and forth, having a discussion with people. Go out to the movies with somebody, but then afterwards talk the movie over. Go shopping with somebody. Go for that walk out in nature with somebody. It's just a very powerful way to help strengthen your mind, and it's been proven over and over again how effective it is. So just as a review, the three best ways you can maximize your brain and increase your cognition: physical activity, cognitive exercise, and socialization. So if you're lucky enough to be a resident in an LCS community, just know that by living there, that in itself is helping you maximize all three areas of physical activity, cognitive exercise, and socialization. Think about it. And say, for example, you're coming out for a meal. Just walking down to the dining room is that physical activity. Cognitive activity and socialization is the conversation that you have with people around the dinner table and with your servers, and engaging your senses, being out of your apartment, being around new kinds of foods, new sounds, if there's music playing in the background of the dining room. So just being in a senior community is very impactful with how your cognition and your memory strength can be. So make sure you take advantage of everything that's offered to you. classes, social events, fitness offerings, healthy meal choices. All of those can be part of what makes your brain function at its maximum strength. You might find that after listening to this presentation that you have questions or you want more information about a particular part of the presentation. If that's the case, I welcome you to reach out to me, and I'm happy to answer your questions, provide you with that information that you're looking for. You're welcome to contact me by email at gregbeth@windermerelcs.com or by calling me at 630-681-4037. You have a whole residential health resource team behind you, and we would like to work with you to help support you with any of this information that we brought to you today. To make things easier for you, each time we're going to have a wellness presentation, we are also going to have a resource guide that goes along with it. The resource guide gives a brief synopsis of everything that was talked over during the presentation, as well as a few additional tips and other resources where you can learn more on your own. So if you'd like to access this, you can click where it says here to print out your own copy. And one thing you can consider is actually bringing that resource guide with you the next time you talk to your physician, so you can talk very openly with your practitioner about all the options that are available for you. If you would like to learn a little bit more on your own, you are welcome to access our YouTube chronic pain playlist by clicking where it says here. It will bring you right to YouTube and has a list of about 9 different videos that will talk further about what we talked about here, including some specific videos about relaxation, meditation, regarding pain control that you can try on your own in your home. We want to hear from you. If you have any comments, suggestions, or ideas for future presentation topics, please reach out to us by the email shown or by calling. We would love to hear from you, and we're always interested in your input. Thank you for joining us today as we talked about chronic pain in our Well-Aware presentations. I hope you enjoyed it. I would enjoy hearing from you and hearing any comments, and I look forward to sharing another presentation next month with you. Best wishes, and be well.